Hello everyone, my name is Dylan Rodriguez. I'm continuing the video series on my research question. If anybody's seen my post from last week, you will know that I changed my research question. Now I'm focused on AI and machine learning and the prevention of ventilator-associated pneumonia. Right now, pneumonia is one of the most deadliest infections around the world, and it's something that, especially ventilator-associated pneumonia, that's something that can be prevented in patients in healthcare. I plan on doing a data analysis research on this using information from patients' EMRs, their electronic medical records. There's different factors into looking at these EMRs, their lab results, vital signs, intubation records, while they're intubated, ventilator settings, and then just doing a data analysis on how these numbers can correlate with each other, and how can these numbers really be used with each other to be put into a model and be able to predict which patients are more likely to acquire this ventilator-associated pneumonia. Also, there's other factors about AI being able to help with the EMRs and be able to shorten the length of ventilator patients and even prevent a patient from going on the ventilator to begin with. AI is coming up big with preventable healthcare, being able to predict illnesses in the future and to be able to stop something before it gets too severe. Like example, with cancer patients, they're being able to detect signs and abnormalities in patients' labs before maybe a physician could see it or a nurse can see it, and set up a red flag to get these patients diagnosed earlier and increase their survival rate. With this AI, I think it can be used broad term throughout healthcare. There's going to be multiple disease functions and stuff it's be able to study and help with diagnosis throughout the healthcare field. And especially, I'm a respiratory therapist. I work in healthcare in the ICU. I'm dealing with ventilators daily, and it's a pretty high number of patients that acquire ventilator-associated pneumonia. We call it VAP. One of the biggest factors is just lack of communication between us and nurses, and just dirty equipment, stuff not being changed out as it should be. I think the AI and the EMRs can work together and be able to provide more notifications, more if a patient's white count's starting to jump up, like, hey, there's an infection brewing here. It's just going to be good for diagnosis. But like I said, I'm interested to see you can take these the data from patients' EMRs and do a data analysis, figure out which one of these what numbers correlate with each other with VAP, and what we can do from our side to be able to reduce those numbers from elevating and reducing VAP. Also, with COPD patients, AI can help monitor COPD exacerbations. These are usually our number one patients that end up on ventilators. He can see red flags, predict when a patient might be coming up on an exacerbation, can help discover which medications help better and be able to teach a patient better and get a patient more involved in their health care, to care more, and just hopefully be able to prevent intubation in the long term. And prevent intubation, you're 100% preventing ventilator-associated pneumonia. But yeah, that's my research question, is how is AI going to help us prevent ventilator-associated pneumonia and unnecessary infections and help better the diagnosis in the medical field. Thank you.